Hello everyone and happy February. I'm Brianna with Coral Gables TV, and today we're here with Dr. Niberto Moreno. He's a cardiologist at Coral Gables Hospital. And in honor of February, which is National Heart Month, we're here to learn a few healthy heart tips. Hi Dr. Moreno, thank you so much for joining us today.
Thank you for having me.
So I know some of the main factors that contribute to heart health are a healthy lifestyle and a healthy diet. Can you give us a little more information about what that really means?
Just using your common sense, what you want to do is you want to do all the things that your body, which really is a machine, was meant to do. So to be active, not be sedentary or sitting down most of the day. Try to put good foods that give you energy and don't cause inflammation in your body. Salt is one of the things that causes a lot of atherosclerosis or plaque buildup in your arteries because it gives you hypertension. And so a lot of the patients that we see in a cardiovascular practice have hypertension, and we want them to avoid salt at all costs.
Okay, perfect. And as far as people who might not be super active in their daily life, what do you recommend for them just sort of working, fitness into their daily lifestyle and their routine?
Get up, start moving, right? So what we recommend is that if you have a sedentary job or one where you're sitting down, try to set your iPad or iWatch or iPhone so that every hour you get up and you walk around for 5 minutes and get to moving. If not, all the research shows that getting active, about 10 to 15 minutes of walking multiple times a day is going to make you much healthier in the long run. And so we recommend that they have a little discipline and they start doing what they need to do to be healthy.
So a little bit goes a long way when it comes to exercise.
And a lot of times people have a really hard time going to a gym or going somewhere in particular and spending an hour and 15 minutes out of their day. And really all the data shows that it's actually better to be active in spurts throughout the course of the day, so you get that blood flowing and you get the blood moving. And
I know another factor that's really, really important is keeping your stress level low. Why is that so crucial?
Inflammation and cardiovascular disease are very intricately linked, and so anything that you could do to decrease the inflammation in your body, like not smoking, not being overweight because fat cells cause inflammation, controlling your blood pressure, eating low in sugar and not having high blood sugars, anything that you can do that decreases the inflammation in your body is likely to keep your arteries and your heart healthier.
And I know some other factors that are important to consider include genetics sometimes, and also smoking and maybe alcohol consumption. But why is it so important for people who are smoking to quit as soon as they can?
An active smoker, the minute they stop smoking, are 50% less likely to have a heart attack that day.
Okay, and so for someone who considers themselves healthy and they're doing all the right things in terms of lifestyle and exercise, they still should be getting their annual screenings. There's a lot of really important health screenings that you should be getting. What are those screenings and what are the ages that people should be going to their doctor to get them?
All patients from the time they're 20 should already start establishing some sort of primary care physician. At this primary care physician, the basic screening tests for cardiovascular disease happen, like labs that look up your cholesterol, your blood pressure measurements. Also, a primary care physician will screen you for a strong family history of coronary disease or heart disease. And in patients who have higher risk due to those genetic predispositions, they can refer you to a cardiologist who can make an in-depth screen.
So if someone comes to you and they're ready to do a more advanced set of screenings, what are some things that you would start with?
An electrocardiogram is obviously a fundamental tool of any heart doctor. It takes a look at the electrical conduction of the heart and can give you insights into how the anatomy of the heart is. Secondarily, there's something called an echocardiogram. It's an ultrasound of the heart or a picture of the heart, just like we do when mothers go to see their babies at their gynecologist's office. From there are other tools that we can use for screening, depending on the risk factors like stress tests or CT scans of the heart or even MRIs of the heart.
One more thing we really want to talk about, since it is Heart Month, what is the difference between cardiac arrest and heart attack? A lot of people don't know that there's a difference, but there is. And so what are the signs and symptoms of each?
Cardiac arrest by definition is when your heart stops beating, and so you need circulatory help, which is what CPR is. It helps get blood to your brain until they can restart your heart. A heart attack is when you have a blockage in a heart artery that prevents blood or oxygen from getting to that muscle. And many times people confuse heart attacks with arrest because one of the main reasons for cardiac arrest is a heart attack. But not all patients who have a heart attack have cardiac arrest.
And so at the first warning sign, what do you recommend that people do for both?
If you're having chest pain that's sudden in onset or acute in onset and you're very worried and you have other symptoms, always go to either the closest emergency room or contact a health provider immediately to get a second opinion on what you should do.
So be sure to schedule a visit with your doctor to make sure you're on track for your best heart health. And to learn more about all the services offered at Coral Gables Hospital, visit their website at coralgableshospital.com. For Coral Gables TV, I'm Brianna. We'll see you soon.